Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal-fetal medicine specialist, which just means a high-risk pregnancy doctor. And today on the podcast, I am very, very, very excited to welcome Megan Pylman. Megan, welcome.
Hi, thank you for having me.
Yes, thank you for being here. And you actually don't live here in town. You live in California, right?
Yes, I live in Newport Beach.
Oh, wow.
So better weather there than here.
For sure. But you're from
I'm from
the
here.
Phoenix area.
Yes, I grew up in like Old Town Scottsdale.
Nice.
Kind of.
And for those watching or listening to, we're in Old Town Scottsdale right now.
Yes.
So this was like your playground,
Yes.
right? Back in the day. Okay. And I've lived here 3 different times. So this is my 3rd time living here. And every time it changes and gets bigger and better. Isn't it one of the biggest places for bachelorette parties?
Yeah, it is. And every time I come home too, there's always new development, new buildings, new restaurants. People will be like, oh, where should I go to dinner? I'm visiting Scottsdale. And I'm like, I have no idea anymore. I'm like, I go to the exact same places every time. And then I see a new place. I'm like, never heard of it.
Yeah.
Probably won't try it.
Yeah. But that's the good thing too.
Yeah.
Like I feel like every time I've lived here, the tried and true places that I liked, thankfully, are still
here.
Yeah.
Yeah. And then they come with like the new trendy places or like the mall. I feel like it's becoming this like huge trendy place where you're going to be able to walk around with cocktails.
Yes.
I don't really know.
It's different. And you know, so the mall's really close. One of the malls is really close here. And I went in there maybe a week or 2 ago and they're remodeling.
It's overwhelming.
It's 3 stories as well, right?
I go to Nordstrom's, I go to Zara, Sephora, and then I leave because I'm too overwhelmed with like everything on the opposite sides of the wings
The little, like, I don't know what you call them, but I always just, Nordstrom is my go in, go out.
Same. It's easiest to get in and out of.
And then recently I have gotten face products from Saks, and they do allow animals in Saks. So I almost brought my dog today.
I would have loved it.
I didn't want him to be too loud, but I got a little like papoose type thing. Is that what you call those? And he loves to like crawl in it and just chill.
Oh my gosh, that's so cute. What kind of dog do you have?
He's a miniature schnauzer.
Oh, cute. So he is like a little pocket purse.
He's 8 pounds.
Puppy.
Yeah. And we thought he'd be bigger, but he's tiny. I know I wanted to bring him today. But next time you're in town, we'll get you guys to meet and stuff like that. No, you don't have dogs right now.
No.
Okay. You had dogs growing up though.
I have dogs growing up. My older sister has dogs. She still lives here. So she has the 2 dogs. Labs.
Yeah. Okay.
But I don't in California.
Okay.
I feel like it's too much work.
Too hard.
Yeah.
So for everybody listening, watching, either one, tell us a little bit about you as far as like what you do for work and like what your day-to-day, I don't know, just a little bit about who you are, and feel free to kind of mention how we know each other, because I think most everybody on the show has been someone I know or someone that I know. And then they're like, oh, my friend has been someone would be a good person. So tell people kind of how we know each other.
Well, thank you for having me. My name is Megan Pylman. Like you said, I met you through my parents, and we're family friends, and we've done a couple like vacations and stuff together. I live in Newport Beach. I work for Monster Energy, do digital marketing for Monster Energy. So
that's so cool. I forgot it was Monster Energy.
Yeah, I know. So I promote energy drinks for a living.
Nice.
And then within the last like year and a half, I was diagnosed with thyroid cancer. And that's when I had talked to you previously about my thyroid issues. And then once I was diagnosed with cancer, my mom and I reached out to you and kind of asked for advice if you knew anyone that had thyroid cancer, if you had patients. Just, I wasn't doing any research at all. I wasn't going on Google, WebMD, literally nothing.
Yeah.
Social media, that's like a dark hole for me.
It is.
So I kind of stayed off of that and asked you and asked a couple other people for advice and kind of just went for it that way.
Yeah. And so let me paint the picture of how, because we had met before, but we
had met before. Yeah. And then we were in Park City. Yep. I was in Park City with my parents.
Yes.
And you and Ed were there, and we went to dinner.
Yep.
And that was around the time I was struggling more than normal with my thyroid. And I think I had just been diagnosed with Hashimoto's.
I think so. I remember, we didn't talk about it too much then. I remember being at the Open.
At the
Phoenix Open.
Yeah.
And we were in this little like nook just hanging out, and then started talking about it. And then your mom and I talked about it. And then you and I talked about it. And I was like, oh, this needs to get checked out. And we just kind of,
because
got in touch that way more.
2021 to now was when it got way worse. And that's when I had Hashimoto's, ultrasounds and all of that. But before then it was, everyone just kind of blew it off as a thyroid issue. Right. And that's when we had started talking to you, because there were more symptoms that I was starting to realize just weren't normal.
And okay, so I'm just diving into this because, and I told her right before we started today, today, my day was probably a day like some of your days have been in the recent past, like a lot of doctor's appointments, right? And healthcare is so broken. It makes me so sad all the time. And I'm going to just tell a little story because I feel like it's going to spark some of your stories.
Yeah.
First doctor's appointment today. I've been to that office before. No one moved their head away from their computer and greeted me and said hi or good morning. No one had told me what to do before my test. Like, do I drink coffee or not? Can I have water? Can I eat? No one prepared me for it.
Can you take any pills, any vitamins before? Yeah.
Yep, nothing. So I just went fasting because I thought that was the safest thing to do. And then they were like, what's your name? Still didn't look at me. And they were like, okay, sit down. I don't know their name. I don't, they don't know my name really. Even they were just like, are you checking in? Yes. What's your, well, I did say my name, I guess, or date of birth, something, and sat down, go do the test, which I still have these scratches from the test because there was these little stickies. I told them my sensitive skin, whatever. It's like scrapes down the side of me or whatever. Anyway, so did that and then had 2 hours before another doctor's appointment. Go to that one. And they were very friendly in the beginning. And I get back into the room. Well, first off, the person who took me back did not introduce themselves. I didn't know if they were the doctor or a nurse practitioner or who they were. And then on top of that, they took my vitals, asked me questions, never introduced themselves or told me who they were. So I'm like, maybe this is the doctor.
Yeah.
And then he left the room and I was like,
and then you're sitting there for 15 minutes waiting for someone to come in.
Exactly. So then in walks a new person.
Yeah.
This is a new doctor visit for me. Okay. And a gentleman, no white coat, no name tag, maybe the doctor because he's wearing slacks. I don't know. And he says, nice to see you again, and puts his hand out. So I shake his hand and I was like, nice to see you. And then he goes, how have you been? Like we know each other. I'm like, I've been well. How have you been? He's like, good.
My life is really good.
And then he sits down and he goes, how have you been since your last visit here with me? And I said, excuse me, sir, we've never met. This is an initial consult that I was referred to their services within the same company.
Yeah.
Kind of thing. So maybe that got confusing.
So it's like he may have heard your name, but has no idea who you were.
Correct.
Never formally met you.
Nope, never. I'm a new patient visit on his schedule. Isn't that weird?
Yeah.
So that whole thing happens, right? And you're just like, this is so interesting. So I felt very kind of like no one saw me all day long, right? I didn't even get a physical exam at the second place. I think he tapped me on the shoulder on the way out or something. And I was like, this is interesting. So I bring that up in going through the doctor visits. And that's just a small little story there to get to the point of even seeing someone in the heart world. And yours is thyroid. Again, 2 organs that are inside the body. Not like you have a growth growing off your face where you can be like, hey, do you see that this is going on with me?
Yeah.
Trying to get to the point of seeing a doctor who took you seriously and really assessed your concerns. How long do you think that took for you?
15 years.
Jeez and rice.
14. The first time I found out I had thyroid issues, which is a very broad term, was when I was 15. I'm 29. Yeah. I guess realistically, I met the doctor that figured out my thyroid issues and found out that I had cancer when I was 27. So at the time, I guess 11 years, 14, I'll be 30 next year. So yeah.
So tell me some of the things that whenever you were initially diagnosed, like 15, you said, was it an addressing of like?
I was in high school and I was losing my hair. And I had never dyed my hair at that point. I used to be brunette, so I had never dyed my hair at that point. So it wasn't like hair dye was making me lose my hair. I was living a very normal life. I was a dancer and I was on POM. So nothing crazy. So I was losing a lot of hair and gaining weight. Okay. And so my mom was like, let's just get your levels checked out. Yeah. She had thyroid issues since she was 34.
Say maybe like a familial thing.
So my mom had thyroid issues since she was 34. And then my grandma had thyroid issues, but nothing crazy.
Yeah.
But again, it's such a broad term. I went and met with a doctor. They put me on medication, said everything looked fine. That was it.
That was that.
And then as like time went on, I had hypothyroidism. Oh, you should be on medication. Oh, you don't need medication. You're gaining weight. Here's medication for your cortisol. Your cortisol is just high. Your adrenals are high. But no doctor, I don't think any doctor ever looked into anything outside of just your thyroid. And that's now what I have learned throughout the past couple of years. And when my friends are talking to me, asking me now, what should I ask my doctor for? They shouldn't just be testing your thyroid levels. They need to be getting your T3, your T4, your TSH, everything inside of your thyroid levels to begin to figure out what is actually wrong with you.
When was the first time they imaged your thyroid with an ultrasound?
So I got one in high school and everything was clean.
Sure.
College, everything was clean. And I had switched through, I probably have had 10 doctors.
From moving and stuff in college? And
I tried to keep them in Arizona just because it was easier, and at the time, I didn't think California was as temporary as it has, or I thought it was more temporary than it has been. And so I had a doctor here, but then he kept blowing stuff off and I didn't necessarily feel seen. And I knew something was wrong and I kept gaining weight. That was like my biggest thing. Oh, like just eat gluten, dairy free, no carbs, less than 15 grams of sugar a day.
Based on what?
Based on my thyroid issues.
Oh, they thought that, okay, so that it was
So
specific.
they basically said, you have thyroid issues. What helps hypothyroidism is to stop eating gluten, dairy, carbs, no grains, sugars, basically eat like a carnivore diet.
So what did you eat?
I'm in high school and college.
Yeah, that's
so
hard.
it was really hard for me.
Yeah.
But at the time, I just kind of blew stuff off, or I went to a naturopath who put me on so many vitamins 3 times a day that it was helping with my weight, but it wasn't helping with the dry skin, the brittle hair, the brittle nails, the anxiety, like everything else that was building up. But to me, I thought was normal because I was living with it for so long.
Yeah.
Like to me, I was just like, oh, I'm going to be tired. Yeah. My skin's always dry. That's just like who I am as a person. Like I didn't realize that was actually an underlying issue. So I went through a couple naturopaths, a couple like Western medicine individuals. And then when it got really bad was like 2020 to 2021. In 2021 of January of 2021, I was diagnosed with Hashimoto's, and that's when I got another ultrasound. They took the ultrasound, said that my thyroid was lumpy, like cottage cheese-like, but they say that's normal for Hashimoto's.
Now here's a question though. Who did that ultrasound and who read that? Do you remember?
Yeah.
And I'm not saying like the doctor's name. I mean, like in the field of, was this an endocrinologist?
So yes and no.
Okay.
The ultrasound was done by an ultrasound tech here in town. I was here in town. And the doctor at the time was my gynecologist, but also worked in internal medicine and worked with thyroid patients. I don't know her exact titles, but at the time, my whole family was going to her. We had heard of other people in town going.
Doing that too.
Yeah.
Now, when the technician does the ultrasound, then a physician has to read it by law. So do you know who read it? Was it a
my
radiologist?
Doctor.
Okay. See, that to me is again, we're just talking in generalities. Yeah. And I talked to Mary Beth, Tamore, because her name sounds like Amore, about ultrasound or ultrasonographers and what they can and can't do, right? Like they can't read the scan, but a physician that's, has studied and is boarded in that field needs to read that scan. Yeah. So I would never feel comfortable reading a thyroid scan. And if this person was an OBGYN, they're not trained.
Well, and to be honest, I don't think most doctors are trained on thyroids at all.
I mean, there's a niche of people, right? And they should be the people reading that scan.
And what I'm learning is there's such a small niche. Like everyone says, I test your thyroid. But no one knows how to read the actual levels of it. So
that's a funny thing that you say. And I think you're so right, because for a person in the general public, right, when you hear thyroid levels, most people think of TSH. However, there's a lot of different hormones of the thyroid.
Yes.
And it's nice to get quite a few of them. And then when you're pregnant, those levels can change. And so I've noticed people get them and then they're like, oh, these are abnormal, but they're normal for pregnancy. Right. But if you're ordering a test, it would be nice that you know what
you're doing or what you're looking for.
Yes.
So that's what happened. So she told me I had on the ultrasound, it was cottage cheese-like lumpy, and there was a 1.5 centimeter spot.
Centimeter. That is large for a thyroid.
But it was nothing to be concerned about. And we will check back in 6 months.
Oh my gosh.
In those
I might throw up.
6 months, I felt myself fully, like my body gave out. And I was like, I finally got to the point where I called my mom and was like, I need to find a new doctor. I'm breaking. Like, I physically, as a human being, I couldn't get out of bed. I had awful hormonal acne. My skin was super dry. My anxiety was through the roof. Like, people said that they could feel my anxiety radiating off of me. And then that's when I found another doctor who eventually figured it all out.
This is kind of when we met a little bit because I remember when I first was meeting you and having this discussion, I was like, I think I got really heated. I was like, well, wait, what? Somebody did what? I'm like,
and I think it was around the time that we found out that there was a spot, because I remember saying to my mom, that's weird, but you can't, most people say you can see or feel it from the outside, and I never felt it.
Well, goiters, like when people get the really big things, right? But those are visible. I mean, I could see across, I've actually said that to someone before, like, hey, did you know you got this big, you know, because you can see them, but
no, I never, ever knew there was anything feeling it, like nothing. There was never anything that was visible. So that was also kind of crazy. So oh
my gosh. Okay. So points to be taken with this. It just makes my blood boil. Internal medicine is big, and then you have cardiology, pulmonology, all that kind of stuff. And endocrinology is a subspecialty of internal medicine.
Right.
However, then you get into endocrinologists that do more with the adrenal glands, more with the thyroid gland.
They have more specific areas that they actually work with.
And some are like super jazzed about diabetes with a side of thyroid, right? Versus, hey, I'm a thyroid guru. And then I manage some diabetes. So you need it to be in the space of that. And what I'll say too is a lot of the symptoms that go along with the thyroid go along with changes in life and also can be blamed on, well, you're a woman.
Right.
So, I mean, maybe it's your period. Or maybe it's because you're pregnant. Maybe it's because you're postpartum. Maybe it's because you
you're
in the
blank.
your
mid-20s. You're growing. Your body's changing.
You're in your 40s. You're premenopausal. You're menopausal. You're postmenopausal. You're perimenopausal. There's always something to blame all the symptoms on. But it's like, hello, like work me up, act like I have a penis, and work me up. How about that?
Or actually just take the time to get to know your patients. And that's what my now doctor does.
In California.
So you found
a great match in California.
So I found
love it.
The doctor that actually, I say he saved my life, but the doctor who actually found it was a reference through a friend. She was an assistant to someone who went to him. And then I started doing research on him, and he was on podcasts, and a very well-known endocrinologist in Los Angeles.
Awesome.
Yeah.
I want to meet him. He sounds fantastic.
He's incredible.
Okay. I love it. So you found him through people that kind of knew him. So that was nice.
Yes.
If you hadn't had that kind of ability where people knew other people, do you think you could have found it a different way? Like, where would you have gone otherwise? Internet? I feel like that's always like a go-to.
I don't know, because all of my doctors in the past have been word of mouth, and they were all in Arizona. And so I would fly home to see them, or my mom was going to them. And then it got to the point where it was so bad. I hate doctors. Like, I hate doctors' offices. Doctors make me not uncomfortable. I just don't like needles, blood. That freaks me out. So I would have probably just brushed it under the rug until I fully realized my body was
breaking,
literally, and I couldn't move or function, was when I finally said to my mom, I'm going to find someone myself.
So when you were going through all this, like before the diagnosis came along of it being cancer, when you were going through the visits and stuff, did you feel like anyone ever listened to you?
No.
God bless.
Because when I was diagnosed with Hashimoto's, I told her, I was like, I am rapidly gaining weight. I gained weight 20 pounds in 2 weeks, which is not normal. And my stomach, I could eat one meal right now. If it had any gluten, dairy, cheese, grains, anything, I wouldn't be able to fit in my pants tomorrow. I would look like I was 9 months pregnant. And she just kept saying, gluten, dairy free diet, like no sugar, no alcohol, basically eat nothing, no seasonings, no olive oil, but you can have meat.
And that was it.
And vegetables, but no I couldn't eat nightshade vegetables.
Okay. I've heard that too. I think nutrition's super important. Don't get me wrong.
I mean, but at the time, and I think the biggest struggle for me was I was still young. So I still wanted to go to eat with my friends or go have drinks with my friends. And I always had the fear of, if I eat this right now, I'm going to have the worst stomachache ever. I'm going to look 9 months pregnant. I might have to go home because my stomach hurts so bad. And now for the next 4 days, people are going to have to hear about how bad my stomach hurts. It wasn't just like a quick take some Tums and you're fine.
Since everything has been sorted and the thyroid has been, you had all of the thyroid taken out?
I had a full thyroidectomy and it spread to my lymph nodes. So they took a cluster of lymph nodes.
I don't think I knew that.
Yeah. So like, I mean, this scar's pretty much gone.
I can't see that one.
Yeah, it's pretty.
They did
this
a good
one's
job.
Still pretty much there. But and it keloided, which was like one of my bigger concerns going into surgery. So they ended up doing a full thyroidectomy, found the same size 1.5 centimeter tumor on my thyroid. They found another 1.5 centimeter tumor in my neck, and then there were 8 lymph nodes that came out cancerous.
How many did they take?
They said they took a cluster. And there were 8. And my surgeon said that if the pathology report would have come back with 10 or more, he would have been concerned that they left more. Like
that's their kind of cutoff.
So they said it was all good from that. So
walk me through, because this is also just like, well, we know that doctors are not the best of people with communicating, number one. But number 2, I don't like it makes me sad that you don't like that you're not scared of them, like they're gonna hurt you. But like just the whole thing brings you pause. But I feel that way sometimes when I go to the doctor's office. But I hope I never make someone feel that way or cause any increased anxiety. What do you think doctors could do to fix that? What can I help them do? Right?
I say this to everyone now after I've met my current doctor. The first time I met him, I went into his office, they took my vitals, and then we went into his office and he sat in a chair and I sat on a couch, and for an hour and a half, he literally asked me everything about myself, not like just from what I do every day, my job, my diet, how I work out. And then he started asking me like, do you get numbness in your arms? Do your eyes burn when you wake up? Little things that I thought was normal. And he fully got to know me as a human being and my lifestyle rather than just looking at my paperwork. Oh, you marked that, you have thyroid issues in your family. You're on a thyroid medication now. Like a lot of doctors just look at what's on paper. They don't try and get to know their patients. Because talking to someone actually tells you a lot more about someone, obviously, than just seeing what someone wrote on a piece of paper. That's like at the doctor's office when they ask you how many drinks a week you have, or, like, what do you eat every day? Well, because a doctor's asking, someone's going to write it a little bit better than if you're having a conversation and feel comfortable with the doctor.
And plus, they're just getting to know you, which is a nice, like, vibe, especially when someone has anxiety, right? Because are you anxious because your thyroid is janky and something's going on? Are you anxious because of your job? Are you anxious just because you're an anxious person, or something contributing to or causing that anxiety, right? And again, as a female, we get labeled a lot of times with, oh, they're just anxious whenever people are having heart attacks. Or
they have
issues.
anxiety. I can 100% say my anxiety was my thyroid. I am not as anxious. Of course, I still get anxiety about little things, but it's so minute and nothing compared to what it used to be.
Isn't that crazy?
It's nuts. Like I'll even find myself before a trip, for instance, my family would make fun of me because I would be packed 3 days before. I'd have all my outfits laid out. Like even if I was just coming home for the weekend, now I'm packing right before I go to sleep. I don't care. It was just little things. It was like almost an OCD factor, but it was more of an anxiety that I had to be prepared. Where now it's like I just walk onto the plane. I don't have to be at the airport 3 hours, 2 hours before like I used to, and just stare at the gate until they boarded.
Well, and you probably had to always worry, especially on trips, like, what am I going to eat? Like, what am I going to do to manage a stomach ache that comes about from eating something, or what if? And now it seems like that's not as much of a concern.
No, and that was the craziest thing. So right after surgery, I couldn't really eat or talk. Like very soft liquids, soup, smoothies. But it was so hard to swallow that I didn't necessarily eat very much.
Yeah.
The first thing I wanted to eat was a bean and cheese burrito.
They're amazing.
Amazing. But the tortilla
Yeah.
would have in the past wrecked my stomach.
Sure.
I ate it, kept waiting for the stomach ache, Nothing happened.
Well, and that right there makes me anxious.
Yes.
I'm like, she's going to hurt. She's going to get sick. And that's what you've like a fear of almost
And then
eating.
one of my parents' friends sent us bread from an LA Jewish deli. And I was like, this was so nice of him, but what if my stomach hurts?
Yeah.
I'm pretty sure I ate bread for like 3 weeks.
I just heard about this amazing deli in California.
Yeah.
Is it Herman that sent the bread?
Yeah, it's Herman.
So Herman told me today, he called me. This is so funny and ironic, but he's like, there's this Jewish bakery deli and he gets the bread sent here
and he gets the bread
sometimes.
sent here, but supposedly it's not as thin as he likes it.
Oh, okay.
Yeah, he has them like slice it super thin, but so he sent me a bunch after surgery.
Was it good?
It was incredible.
Okay.
But I was on the bread diet for a week and my stomach never hurt. So now I definitely still eat. They say, I guess, after surgery, you should still remain as gluten and dairy free as possible, but don't restrict yourself. Like if at home during the week, I try and buy gluten dairy free stuff, but I'm not going to restrict myself when I'm out if I want it.
Sure.
So of course, if I'm eating mass amounts of it, I'll get a stomachache, but that's pretty much everyone, but nothing near what I used to get.
Oh my God.
Yeah.
So tell me this, because I feel like your doc probably prepared you for anything, because you even mentioned, see, the fact that you know terms like keloid.
Yeah.
I'm going to make an assumption that your doctor told you it is possible that your scar might be larger. Did they prepare you for that?
No.
Oh, I thought maybe
so
they would.
I'm not quite sure why I know what a keloid scar is.
Because I was like, most people don't know that term.
One of my parents may keloid, or maybe I didn't research at all, but my doctor is known for having really perfect little scars. So like when I took my strips off after surgery, it was like 2 weeks after surgery, super small, but going into surgery, they had a plastic surgeon in there or someone watching it with him. And I said to him, I was like, my biggest fear is to have a keloid scar in the middle of my neck.
Right.
And they were like, we'll do everything we can, but there are some people who you just can't prevent it. We could do everything and try, but unfortunately that's just your skin.
Yeah.
So they didn't promise me I wouldn't have one, or I would, because they can't.
Yeah.
But unfortunately I did keloid.
This one didn't keloid at all on the side.
Yeah. I mean, I wonder if it's just different skin. I don't know. But yeah, this one definitely, it's gone down a lot. Like it used to be super, super, super red and thick. And now it's definitely gone down, but it's not cute.
You know, for me, scars, I like scars in a way. Because at least, it gets you a story. And
it's a conversation starter
like a tattoo,
at the bars.
Right? Yeah, it is, for sure. And it'll get you some discussions.
Yeah.
But when you had the surgery too, it wasn't just like, I say just, you had a surgery on your neck, which is nerve-wracking because they're going very close to your vocal cords. You know, any surgery is nerve-wracking, but still, this one just makes me nervous, right?
Yeah.
And they're going in very close to big vessels that are in your neck.
Yeah. So this is also crazy. So when they did the initial ultrasound here in January of 2021, and they told me, don't worry about it. In November of 2021, my doctor was like, we did one. He held up both of them and they were mirror images of each other. And thyroid cancer doesn't spread very fast or grow very fast. In 2021, 3 days before Christmas, or I guess December 16th, I got a biopsy. They sent me into biopsy. On December 21st of 2021, my doctor called me and said it was 90% cancerous, but they wouldn't know until they sent it in for genetic testing.
Okay.
August 14th January 10th, I got a call that it was confirmed 90% cancerous and that my doctor was going to send me surgeons to research because they obviously can't say.
Right. And this was the doctor in California that
you need to, they can't tell you need to go with a certain surgeon.
Right.
So they gave me a list.
I'm going to interrupt you real quick. Yeah. The doctor that found this and did the biopsy,
the biopsy was done in California with my new doctor.
Yes.
I met him in August of 2021. And is
that the same person that's not the one that would do the surgery to remove the thyroid?
Right.
So that's also something to be aware of.
Yes.
That this isn't there's multiple people involved in a team of doing this.
Yes.
It's not just one and
so
done.
So he is an endocrinologist in Los Angeles. Mm-hmm. He called me before Christmas on my phone. I was picked up thinking nothing was wrong.
Sure.
Said that, okay, well, I'm going to go on with Christmas. I didn't think anything of it. I was like, there's no way I'm the person that has thyroid cancer.
Right.
Absolutely no way. Have Christmas with my family, get back to work. January 10th of 2022, he called me and said, I'm going to send you surgeons. Mm-hmm. You're most likely going to need the left side out. But again, I'm not a surgeon. You need to meet with someone. This
is an ear, nose, and throat doctor now, or what?
This is still the endocrinologist.
But he's giving you lists of what type of surgeons? Are they otolaryngologists, ear, nose, and throat doctors?
Ear, nose. I think my surgeon was an endocrinologist surgeon.
Okay. This is where I would need to. Even as a physician, there's so many ways you can branch off and do this. And
yeah, he sent me some ear, nose, and throat doctors and then a few endocrinologists.
Okay, because some of them are surgeons that then I'm assuming do subspecialty training in
thyroidectomies,
whatever kind of stuff. So again, questions to ask. I'm like, hey, what kind of doctor are you?
So I think my endocrinologist sent me a list of 5 doctors.
Got it.
I, of course, sent them to my mom. And was like, will you help me figure out who to go to? We made appointments with 3 doctors. Mm-hmm. They all couldn't get me in for 2-3 months.
Oh, man.
The next day, one of the doctors had a cancellation for 3 days from then.
Oh, nice.
So I went to him. He did an ultrasound. And as he's doing the ultrasound on my neck, I had never had an ultrasound go up this high, but he went up to my neck. And that's when they saw that it spread.
The lymph nodes.
Lymph nodes.
I got you.
And then once he saw that, then they said they need a full thyroidectomy. But with thyroid cancer, they don't necessarily know if it's cancer until it's out, which I didn't know. I don't know if that's normal with other
all cancers.
But to me, there's not enough research on thyroid cancer or enough conversation around it that no one knows what's happening. Mm-hmm. So I spiraled.
Yeah. Well, I mean, that makes sense.
Yeah.
And this all is like right after Christmas too, mm-hmm. right? And you're starting the new year.
Yeah.
And,
So I met the doctor January 14th, had surgery March 1st, radiation in April, and was in remission by May.
So this is the question too. Not only did you have all of your thyroid out, mm-hmm. I'm assuming a lot of the lymph nodes on the left side of your neck. You also then had to recover from the surgery mm-hmm. and then go through radiation, mm-hmm. which I don't know much about it because I don't know that space very well. But it's not just like
it's different.
Right. Tell me, because I think it's like it's a lot.
It's a lot and it's different. And so my biggest thing was, like I said, I didn't research anything. So it's kind of word of mouth, but no mm-hmm. one knows about it. And thyroid issues are very common. Mm-hmm. Everyone talks about them, mm-hmm. but no one talks about what happens if you have cancer. Mm-hmm. So I kind of just went like, I'm going to let my doctors tell me what's happening, and that's that. So I get my thyroid out. You have a chance of losing your voice or a chance of having a raspy voice for the rest of your life. I personally think my voice changed like very little, but right after surgery, it definitely changed in the first like 6 months. And I had a very deep laugh. Like,
that's cool. Yeah. I mean, like, that's not bad.
My
right?
friends loved it. We had a lot of fun with it. But so after that recovery, what they don't tell you is how stiff you'll be. I was told like I'd be neck? Up and walking within 5 days of my surgery. I like physically couldn't move my neck from left to right at all for 6 to 12 months. And I'm still pretty numb.
6 to 12 months?
And I'm still numb. Yeah.
Did they say that because of the lymph nodes that there's any nerve concerns or anything like that?
There's a possibility with nerve concerns, but again, everything's a possibility.
Yeah.
No one tells you. And I don't know if it's because they just don't know and not a lot of people talk about it, or if they physically don't know if there is. Because I'll talk to people and I'm like, oh, I'm still numb. And I've even said to the doctor, they're like, oh, it could be forever. It could be for a year.
Yeah.
You never know. It's just different how different people react to everything.
Wow.
Yeah.
Okay. But radiation, though, to this part of your body, mm-hmm. did you have to do radiation just for the neck?
So it's an iodine. It's radioactive iodine.
Oh, okay. Gotcha. Mm-hmm. Okay.
Yeah.
But so it's a process. It's not just.
It's still a process. Yeah. So it's not I'm not too familiar with other cancer radiation, I guess is how I would say.
Yeah.
It's not like you go to the hospital, you do radiation. I don't know how they do it. And then you go home. This is you take a pill and you go basically quarantine in your room for
you are radioactive.
Yes, because I am fully radioactive, and you are in your room for 4 to 5 days alone. And anything you touch,
they don't tell people. Did you know that?
I didn't know this until I had surgery and they confirmed I needed radiation.
And then I
met with another endocrinologist through the hospital I had my surgery at, because my normal endocrinologist is not affiliated with UCLA Medical. So they basically tell you that the 2 weeks leading up to radiation, you have to have a low iodine diet, so no salt. You have to cook all your own
shrimp,
food,
right? Like that has high, or not a lot of shellfish or something. Like
I think I ate the same salad and basmati rice for 2 weeks.
Awesome.
Yeah, which
and no salt, like you said,
and no salt, and then it could only be it had to be under a certain amount of salt. But if you look at like raw chicken at the grocery store, there's at least 70 grams of salt in it already.
70 milligrams.
Or 70 milligrams of salt already.
Everything has salt.
Everything has salt.
A can of tuna fish probably has 500 milligrams of salt in it.
So it was a very bland diet leading up to it.
So,
and then
because you think I'm going to take a pill and that's it, right? But you're not. This is a week of dietary changes.
2 weeks of dietary changes.
2 weeks of dietary changes. You take the pill. You're quarantined basically-ish for 4 days.
Yes.
And then how many times did you have to do that?
So you take it once.
Okay. Oh, that's good.
I guess they gave me the highest dose you could have.
Okay.
Because it needed to be zapped.
In hopes to not have to repeat it. Got it.
In some cases, people will have to repeat radiation, but I don't know how often that is. Yeah. But when you are radioactive, anything you touch has to be thrown away. So I had like a tarp over my bedroom.
This isn't
rug.
Funny, but I'm just imagining you in like this bubble.
My mom flew in. She helped me. I got a mini fridge in my room because my roommate moved out because my bathroom was not in my bedroom. So I had a tarp that led from my bedroom into my bathroom, covered my rug so I wouldn't have to throw the rug away. All of my bedding, everything was in the living room, far enough away that I'd be able to use it when I was done. Went to Target and got a sweatshirt and sweatpants and pajamas to just sit in.
Yeah.
But when they give you radiation, you could either be really sick or you don't feel anything for 5 days. So you're just sitting in a room. I was really sick.
Oh my gosh. So you hear radiation and even my mind went straight to like physical, something that you like to irradiate or whatever. Right. But then I was thinking if they took your full thyroid, you probably didn't. That's not what they were going after. It's more the taking of the pill. Yeah.
The way they explain it to me, because of course I had to think about if I needed to freeze my eggs or children, the way they explain it to me, and I talked to other doctors, is the pill just basically you swallow it and it attacks the thyroid tissue that's left. And then you pee it out. So you drink enough water in those 5 days to go to the bathroom every hour.
You peed out cancer.
Yes, basically.
So rad.
So there was nothing that was to be harmful to my eggs or anything. So they said some people do, but they said more often than not, people just get it done with.
Yeah.
But then before they gave me the radiation pill, they did a blood test and then they were like, a pregnancy test. And then they were like, if you're trying to get pregnant within the next year, you won't be able to. I had no issues. I didn't need to. So to me, that doesn't affect me, but it will affect other women who have children or,
And they can't, and then you bring up a good point, is that if you're currently pregnant and you can't
do radiation,
because the levels of exposure to radiation clearly are so high.
Well, and the way they give you the pill is the most insane thing ever.
Oh, is it like a process of like...
You go to the hospital, you wait for them, and then they put on the X-ray shield on myself, and they come in basically hazmat suits. They basically come in hazmat suits and put gloves on me. And so I'm sitting like this, and they come with a like metal cylinder, and they twist it off, and then they take tweezers and pull out a glass cylinder and pour the pill into my hand, and I take it, drink water, and they make me sit there for 20 minutes. And then they basically look at you and say, okay, go home and we'll see you for
so
your
you've got a little window to
scans.
where you're not
You
as
have a little,
active or
yes,
whatever.
you must have
say.
a little bit of a window because you clearly can walk out of the hospital. There are, I think, cases that you have to stay in the hospital for radiation, but I think that's if you don't have anywhere to go, or if my roommate wasn't able to move out, or if insurance would cover it, then I think there's a chance you could stay in the hospital for it.
I am realizing right now, I mean, I've gone through medical school, residency, fellowship, and been in practice almost 10 years now after all that stuff. And I've had so many patients who have had this. And I'm like, great, you're taking care of it. Let's talk about your thyroid now while you're pregnant. Never once did I ask what it entailed. It wasn't pertinent at the time, but I'm fascinated. And I'm sure I learned that one day in medical school and wrote it down.
Yeah.
But that's a lot to
no
go
one
through.
Tells you. Like even now I say to my mom or my family or friends or anyone who asks, they say you have the best cancer you could have.
Okay,
it's curable.
I like that
and
too.
Everything's gonna be okay. But they don't necessarily tell you, like I said, they said I'd be walking in 5 days after my surgery. I wasn't walking for 2 weeks. And even then I could barely drive because I couldn't turn my neck. And obviously everyone's different. So I'm obviously not a doctor and I'm speaking for myself, but they don't necessarily prepare you for the worst or what could happen. They just, you're going to get it removed and everything's totally fine. And everyone lives a very normal life, which I live a very normal life, but it's those first couple months of trying to get your pill regulated because now you don't have a thyroid. So one little pill every morning.
So that was my next thing. So then you're going to be on a type of likely levothyroxine comes to my mind. Not necessarily that one, but that's the non-name brand.
Of Synthroid.
And for the rest of your life because you don't have a thyroid, therefore you're taking this pill. And it's supposed to be in the morning with no food, right?
45 minutes before your first meal.
See? So, I mean, it's not even like just take a pill once a day, right? It's like take a pill every day in the morning, first thing, time it. That's lifelong commitment.
Yeah.
Right?
And what's funny is, so I was on levothyroxide. I think that's how you say it.
Levothyroxine.
Yeah. I'll leave it to the doctor.
Synthroid's easiest to say. That's what people say.
Synthroid's easier. So I was on that.
And they branded that, and that's good because sometimes they put a name to a pill and you're like, I can't spell it. I can't say it.
I couldn't spell it the first couple of times people asked me about it. So I was on that from the hospital until radiation, felt totally fine. After radiation, I started to feel like I did before surgery. And so I was switched off of that onto Armour Thyroid.
Okay.
And I think, if I'm saying this correctly, Armour Thyroid has more T3 in it. And so that's what I was lacking. So that's why he switched me, because it had more T3 and that's what I had always lacked.
There you go. And you bring full circle. That's why looking at all the thyroid levels would be something that's very important, because some people it's more of a T3 versus T4 or maybe both issue or whatever, and trying to find the right dose, but also the right thyroid replacement medication that you need could vary. So like I do tell people in certain fields, like if you're internal medicine or you do what I do, or like internal medicine for pregnant people, that if it's not a slam dunk basic levothyroxine fixes it, I'm sending you to an endocrinologist because I can get the labs and I know what normal is in pregnancy. However, the replacement and the little niche that they're in, that's not my niche. And I am super, super fine with saying, hey, this is where my knowledge to this level stops. I know who to send you to. And I feel that sometimes everybody in various fields, it's like, I always think about it, like, you remember Hitch? When he's trying to teach him how to dance and he was like, stay right here. You stay right here. And then he tries to do his little like Carlton. Stay in your lane. And like, there's a nicer way to say that, I'm sure. Of course. But know my limitations or when I can say, here, I'm going to hand you over to someone who can tweak this little bit, a little more than I can.
And I actually had an appointment with my doctor yesterday. We did a virtual call, and he also has told me in the past too, that I think they can prescribe you to where I would take my pill in the morning, 45 minutes before breakfast, but then give another dosage in the afternoon, like before lunch or something. If for some reason someone's like goes really high and then drops in the afternoon, which is how normal hormones are for some people. And that's how it was for me originally. But he was like, let's test your levels just to make sure that we wouldn't need to do something like that. So then there's, of course, another pill that you'd have to take. And if you forget it, then you're super drowsy. And like to be honest, I forgot to take my pill the other day because I'm traveling and it was in my purse.
Yeah.
And when I'm home, it's next to my bed.
Yeah.
So I wake up, turn off my alarm, take my pill right away. And I finally looked at my mom and was like, I didn't take my pill today and I feel like I haven't slept in 4 days. And It was like 12 o'clock in the afternoon.
Yeah.
Which you would think maybe, or maybe it's in my head, but like it was a big drop.
Yeah. Oh my gosh.
Yeah.
So as much as it's like the good kind of cancer, I mean, hopefully it won't come back. I mean, you have a thyroid, which is great, but your life forever had to change. You're always going to be on this pill. And you brought up the point, which is kind of part of, being around here with me on the podcast too, is like, if and when the day comes when you're like, I'm working on having a family, or I'd like to start a family, it brings up a lot of questions and things like that. And the beautiful part with this is, like, I had a friend who had breast cancer when she was really young. So she had to make all the decisions of freezing eggs when she was not with a partner at the time and didn't know she wanted to have kids, right? So you're thankfully in the realm where you still got ovaries and a uterus and those things, which is great. However, when you become pregnant, if that's what you do, you can stay on this medicine, which is great, which is awesome.
Yeah.
It's very safe in pregnancy. And then they check your levels throughout the pregnancy. And the really kind of interesting thing here that people might know is when you've had hypothyroidism of some sort in the past and you've had the thyroid removed, it depends on if you had part of it or not. And if it was due to a cancer, where we want your TSH to be in a pregnancy.
Oh, really?
So we're more specific and we keep people more tightly controlled.
Right.
If the reason for the thyroidectomy was due to cancer.
Okay.
Does that make sense?
Yeah.
Just, and we always have them still follow with their endocrinologist too.
Right.
Which is important. But and thankfully you live in bigger cities where I think you'll have the resources of those people no matter where you are.
Yeah.
Especially if you stay in like California or here in Arizona, because you know the people. But I can't imagine the people that live in the smaller towns, right? Who have moved a couple of times and, they can't get into an endocrinologist for 8 months.
Or don't have access to a doctor at all.
Yeah.
Or don't have access to a doctor that actually listens.
Yep. And you know what happens though too, and this irks my soul, and this has happened before, a patient was on a thyroid medicine of some sort. They get pregnant and their physician tells them, well, you can't take thyroid medicine in pregnancy, so stop all your thyroid medicines. I've seen that happen. I've also seen a pharmacist tell a patient that had hyperthyroidism to stop all their medicine because they were pregnant. And they came in with something called thyroid storm, where they become really tachycardic, like their heart rate's really high, and they can get really, really sick.
Yeah.
But their pharmacist refused to refill their prescription because they were pregnant. And I was like, holy cow.
Yeah. Well, and what's crazy too is, again, a pharmacist is telling you can't take it. But now with social media and every platform, there's talks about thyroid or this or that, where there's more information that you can actually find if you want it, I guess. Like, I didn't do any of it. Now I'm kind of just starting to dabble in information, and still I'll exit out because it freaks me out, even though I've already had it. But people who don't research or advocate for themselves will never have the correct care.
Yeah. And I had somebody on recently who was talking about this, and she gave it like a really good name, and I can't remember the name she actually used. And then she explained it better because I didn't understand what she meant. But it was this space of, it's like data firewalls or something walls, where certain physicians that in certain hospitals and whatnot have access to databases that have studies and stuff, right?
Right.
Well, we have to pay to, be part of that society or whatever. And then you get access to PubMed and all these other different things. And I never really thought about it, but when you're in the general population, you don't have access to that. And I actually started thinking about it when she mentioned it, but also when I went from working at a big hospital in a group to then doing stuff by myself, I lost access because the hospitals usually, or the group buys them for the whole, all their employees. So that was gone. So then I started researching, okay, if I want access, how much do I have to pay per year?
Right.
Sometimes it's $1,000 a year just for me. And that's one database.
Yeah.
And it's like, holy cow. And that's where, the question is, if the general public doesn't have that access, then what is the information they're getting from the other people who don't have that access? Right. And that's where I think a lot of the misinformation and like, you can drink castor oil and this will fix this, or, rub tobacco on your whatever. And the weird stuff. But then I see this kind of gap of, if the general population doesn't have access to this data, what are they basing it off of, right? And then the flip side that some people say too is, well, if they have access to the data, can they interpret it correctly? Maybe not. But that also gets me into statistics. Did you ever have to take a statistics class in school?
Yeah, but I'm really not good at math, so I probably just barely passed my statistics class.
I'm not good at math. And most anyone that I know knows that. I'm like counting on my fingers. If it's above 10, I'm like, calculator.
Yeah, calculator.
But there's just this way to evaluate data. And I've seen some people online that do it wonderfully. They're like, hey, somebody's talking about this one thing. And they say it's about the thyroid. And they're like, hey, they say that carrot juice can cure this, or that this is toxic to you. And it's like, but if you read the study, there were 2 people in that study. And they both had an allergy to carrots or whatever, you know? So like, if you don't know how to break it down, and I think that's the fear of people in the medical community is like, if we provide all this data, then the general public is going to freak out about things that really are not pertinent or concerning. And we still see that sometimes in social media where people will post like, there was something on, I don't know if it was xylitol or something that was like in drinks. Like maybe even in energy drinks or something.
Probably.
Like, it's causing this, that, or the other. And it's like, that's one ingredient of like all these ingredients. Or, it's the amount that it was given.
Or even people on social media, I see it on TikTok all the time. I reversed my hypothyroidism or Hashimoto's by doing X, Y, and Z and changing my whole diet and doing this and that. And great for them. More power to you. Some people actually cannot reverse it themselves. And that's what I think a lot of people have a misunderstanding about too, because social media is putting that out there. It's one person, you could fully reverse it yourself. I pretty much tried everything. There was no reversing it. Obviously cancer is different, but not everyone is the same. And that's what a lot of doctors, I think, is like, oh, you both have thyroid issues, just take this and it'll be better. But it's people that actually sit and learn about you, or like you said, statistics. Like, it's not just the statistics and the math behind it. It's actually learning what's going on internally. Which no one does.
Everybody is different. I mean, you can't put 2 people with even this Hashimoto's next to each other, and they're not always going to be treated exactly the same. I agree with you 100% on that across the board. Just listening to patients. And having, I think empathy is a great quality to have, to be able to just kind of like how would you feel in that situation if your doctor just was like, yep, checked all the boxes. Okay, here's your medicine and your prescription.
And for years, that's all it was. For a thyroid to be that dismissed for multiple people is even more scary.
Because that you make a really good point. Because like if your gallbladder is messed up, take it out. If your appendix is messed up, take it out. If your liver's messed up, you can take out parts of it and it will regenerate. The thyroid, if you take it out, you're on supplementation for life. So clearly you need it to function, right? Uterus, we take those out. I mean, we don't want to, but those can come out. Ovaries can come out, but then you usually have to do something with hormones, because those are kind of, the hormones if there's any organ that deals with a hormone at all, and the thyroid's a huge one, clearly.
It's common, and you hear more now. And again, it's probably social media, why you hear about it, and hormones and thyroid and endocrine disruptors and all of that. You hear more about it now, obviously because of social media, but still there's not one doctor that sits and explains to you what a thyroid does. You have to Google it.
You do.
Or you have to know someone, that's gone through it that can explain it to you. Like when I was diagnosed with thyroid cancer, more people asked me, what does your thyroid do? Than saying, oh, I knew someone that had that. Like no one knows what it is. But everyone has one.
That's so true. And honestly, if you took if you lined up like 10 different doctors in 10 different fields that are not endocrinologists, you would get 10 different answers, and probably half of them would be either I don't know or way wrong.
It's in your neck.
It's in your, I think most of them, would get the location right, but not the function.
No. They'd say it's a butterfly. Like a butterfly object in your neck. Which that's what it is. That is what but no one knows how to actually explain what it is.
It's
so then there's doctors like telling someone your thyroid's off or your thyroid's fine, but they don't even know how to explain what a thyroid is.
That's well said.
It's just your hormones.
I like that.
Yeah.
Air quotes, I air quote a lot. It's just your hormones. Wow.
Yeah, it's crazy.
Our goal, expanding knowledge. We did that today. I learned a lot today too.
Yeah.
So we did that. We expanded our knowledge. We developed our skills. I think a lot of what we talked about today were the skills of advocating for yourself, asking family members and friends. That was huge in my mind's eye. And then the I impact. This has been huge for me because like the way that you talked to people was great along the way and advocated for yourself. But the fact that you got to the right person, got everything done. My big thing on asking at the very end of any podcast is like, what would you want to tell someone and I looked up impact because I'm big on definitions. It's like, I feel like it's something that we're always like, have an impact. They had an impact on me, whatever. But it's hard to sometimes describe. You just like, some people say it impacted me.
Right.
But describing how that happened, like it's a positive effect. It's an effect you've had on something or someone. So like, how would you, I guess, tell people out there of the impact that this has had on you and how you feel that your story can help and impact other people?
I would say to always get a second or third opinion, even if you feel like you're comfortable with what your doctor has told you. Because for so long I was comfortable with, you have a thyroid issue, have a gluten, dairy-free, clean diet, and just take your pill. But if you actually know your body, which most people do, or you can tell something's off, get a second, a third, a fourth opinion. Unfortunately, it's going to be probably pretty pricey, but the money compared to your health is so much more important. Yeah. Like your health overall is so important. Yeah. And I think that there's not a lot of talk around thyroid, even though it is so big, that I think asking people questions and getting answers, because no one tells you what actually is going to happen. Doctors say you're going to be fine, which you are. But for the first year, I kept my head down and I was like a broken record telling people what happened until I finally lived through it and realized like, okay, I'm going to be fine. Yeah. It's not just your world is over. Yeah. It's over for like a half a second. Not really. A
little longer than that. Again, the math is so bad.
I was going to say I'm lying because it was definitely like a full year that I was like spiraling. Yeah. But now looking back at it, if I didn't advocate for myself, I wouldn't be sitting here talking about it.
Right. Because if you hadn't gotten to that doctor having had talks to other people, the cancer may not have been identified. And this could have been a whole different story.
Right. It also could have just been me living how I thought was normal. Right. Or living the life I thought was normal.
Because those are the limitations put upon you. Yeah. Mm-hmm. Well, I'm so excited that you were here today. I'm so glad that everything is good. I'm so glad that the nodes were overall good over there. And I love your battle wound.
Thank you. I know. It's a good topic conversation.
It is.
Thank you so much for having me.
Thank you again. And everybody, if you want any more information on some of the stuff we talked about today, I will put some links below. I'll put some downloads below as well. And I'll make sure to check in with you too in case there were any things that you found that were helpful for advocacy or platforms that you maybe searched and you kind of vetted a bit and you're like, hey, these were actually really good. Yeah. I'll work on including those below too, just so if you're going through something similar to this or you have a friend that kind of has questions or wants to learn from a good source and a good website, we'll work on doing that too. Yeah. Awesome. Thanks. Well, I hope you guys expanded your knowledge, developed some skills, and that you can feel the impact that we are trying to have on everybody out there. I'm Dr. Lexi, and as always, wishing you a happy and healthy pregnancy.